Pharmacy Podcast Network.
Welcome to the Farming Your Career podcast with host Dr. Aaron L. Albert, where we explore a variety of healthcare and pharmacy-related topics, including career development, healthcare IT, informatics, innovation, entrepreneurship, STEM, women's issues, and more. Farming Your Career podcast is part of the Pharmacy Podcast Network, and Aaron has had the #1 most downloaded episodes of 2016 and 2017 of the entire Pharmacy Podcast Network. Now, here's your host, Dr. Aaron L. Albert.
Welcome to Farming Your Career. I'm Aaron Albert. This week, we're continuing our wildly popular series, How I RX Roll. Not focused so much on what it is that you're doing as a pharmacist or a healthcare professional, but how you're doing your work. This week, we actually have a recent graduate to the fold. His name is Dr. Geoffrey Brown, and Geoff is a recent graduate from the University of Buffalo School of Pharmacy. He's also a study coordinator at GPI Clinical Research and a quality manager and patient liaison at Antidote Technologies. Geoff is interested in drug development, behavioral health, and health IT. Give a listen to our third episode in the mini-series, How I RX Roll, with Dr. Geoff Brown. Okay, well, we're here today with Dr. Geoffrey Brown. Geoff, welcome to the show.
Yeah, thanks for having me.
So we are continuing our series on How I RX Roll. We're talking more about how we work as non-traditional pharmacists now versus why or what we're doing professionally. But I always like to start with the first question. How did you get to where you are today in your own career, Geoff?
Yeah, so I think it makes sense to sort of start off what my first pharmacy job was. My first pharmacy job was at McKesson Corporation, so I worked for a distribution center, and that was actually before I started pharmacy school. So I packed prescriptions for Wegmans pharmacies, and I did that for about a year and a half. And then when I entered pharmacy school, I quit that just to focus on academics full-time. And then I got a job at a hospital. So I worked at a hospital in Buff General, primarily in the IV room, and I stayed there for 2 years. I thought I was interested in hospital pharmacy. I thought I was going to go the residency route. And then when I was still working at the hospital, I started doing patient counseling and sort of more clinical pharmacy type things. And I ended up reaching out to you. So it's funny that we're doing this podcast because you connected me with a company that was doing health or clinical trial recruitment, and it was sort of in the health IT realm. Mm-hmm. And so I reached out to somebody that you connected me with there. They ended up getting me a part-time job, and I ended up really liking it. And I knew I was sort of interested in clinical research and clinical pharmacy. I always thought, like I mentioned before, I would do residency and then go on to sort of do clinical research after, getting some experience as a clinician. But I was really thankful for this opportunity to work with this company. The company's name was Antidote, and it sort of exposed me to like the startup realm and sort of all the opportunities that there are in health IT and drug development. And I had another really lucky thing happen. My friend's dad ended up being my mentor, and he was a pharmacist that partnered with a psychiatrist, and they run clinical trials out of their doctor's office. So I had two really lucky things happen. I had you connect me with that startup company, and then I had a personal connection with somebody that was already involved in drug development. And I still work for both companies now. I did like a 12-week rotation at that research site that I mentioned where my mentor works. Okay. And after that, I sort of really found that that's what I wanted to be doing. And it was really awesome. You get the perfect mix of patient contact. You become like an expert on whatever drug you're studying that's in the pipeline. And, the clinical trial, it involves such close follow-up with the patients. We're doing trials for patients with schizophrenia, And it's just amazing what an impact you can have in such a short amount of time because the follow-up is so close and you're following the patient so closely. So you can really get patients, their lives turned around and really get them on the right track in a short amount of time. So I found that very rewarding. And the other thing I thought was really cool was it was a lot more hands-on. So you don't do a lot of hands-on patient assessments and things of that nature. As like a ordinary pharmacist, I know we learned about patient assessment in pharmacy school, but I never actually like did blood pressure or did listen to patients' lungs or things like that until I started working at this research site. So it's been really cool. You get a lot of face time with the patient. I'm just training now on like administering rating scales.
Okay.
So I'm training on this thing called the Columbia Suicide Severity Rating Scale. So it's an assessment of suicidality, and it breaks it down into suicidal ideation, self-harming behavior, and suicidal thoughts and actions. And it's really cool because not a lot of pharmacists are trained to like administer these rating scales, and it's something I can add to my CV. And eventually I want to be able to do drug studies like what my mentor did, is partner with a physician and sort of run drug studies on my own as like either a PI or a sub-I.
Okay.
So it's been really awesome. And I think the combination of working as a study coordinator at the site and then having the experience in recruitment with Antidote sort of really set me up with like a unique perspective on things. So it's been cool to see both sides of both recruitment and then actually conducting the trials.
Cool. So take us through what kind of setting you're in for most of the week. Is that a physician's office then?
Yep. So we're in a psychiatrist private practice, small office, but there's like an extra office space for the pharmacist and his office. And then there's like a small desk that I work at. And then like we have a very small conference table where like we'll see patients.
Okay.
And there's like an exam table where we do like EKGs, and we have a scale. We also have like a centrifuge, and if we got to have a freezer. So these are all these different things you need that are in the office for conducting the trial.
And when you're side hustling with Antidote, for lack of a better term, what does that office environment look like for you?
Oh, so when I'm side hustling with Antidote, which is awesome because it's super flexible and they kind of let you, schedule your hours. So I work two different roles with Antidote. One is sort of like a coding job. So it's given me some background in programming, which I think is really cool and crucial to have nowadays. So it's all work from home. So it's amazing. So my office, work from home office is literally just my desk. I can just sit in my, pajamas or sweatpants or however I deem appropriate and just work and make money for Antidote. So I like having that flexibility with a side gig like that. So
you kind of have two different office environments that you roll between, right?
Yeah, absolutely.
Cool. So let's talk a little bit about mechanicals. Are you a iPhone or Android person?
So I'm actually an Android person.
Oh, okay. And what are your favorite apps right now?
Headspace is definitely one of my favorite ones.
Tell me about that. What is it?
So Headspace is a meditation app, and it has all these guided meditations that just help you relax. And I started meditating like about 2 years ago, and I find it amazing. Like it just helps so much with my focus and my stress and anxiety level. And I can notice when I meditate for like 2 to 3 days in a row, my productivity level just skyrockets because you're able to just focus in on a task and just pay so much attention to it without worrying about anything else. Okay.
Any other apps?
Let's see. I don't have my phone. My phone's in my pocket. Let's see. I have the LexiComp drug app.
Okay.
The natural medicines app. I get a lot of questions from friends and family about like pharmacy related things and supplements.
Yep.
So I use those to sort of look things up. Definitely Shazam. I love the Shazam app. That's on my homepage.
We were just talking about that this week at Midyear.
Yeah, Shazam. What would I do without Shazam? And then obviously Calendar, because I feel like I'm really busy. I'm always accessing Calendar.
Okay, and what type of computer are you?
So this is weird. I'm a Mac computer guy, but I'm not an iPhone guy. So I use a Mac.
Huh, interesting. Did you ever have an iPhone?
I did, but I was converted.
Interesting. All right, so let's boil down your work style into one word. What would that one word be?
So I don't know if this is, I was thinking about this before. I think sporadic. So I think I work in pockets. Like I'll just get super focused, like I was mentioned, and just knock out like a huge task. And then I like won't be working as hard for like a little while. And then, yeah, so it comes in spurts.
So it's a burst and taper kind of thing.
Yeah, exactly.
Okay. All right, cool. So like, can you walk us through a typical work day for you, Geoff?
Yeah. So the cool thing about being a study coordinator and my job is that, some days are super hard and where there's a ton of things to do based on what visit it is and how far along in the trial the patient is. And then some days are really quick. So sometimes the patients just come in to get new medication and, sign a stipend that we paid them and then go home. So a typical day might look like I get to the office at like 8:30 and then I'll pull all the documents that we need and all the assessments and source documentation that we need for the day's visit based on what patient's coming in that day and based on what visit they are on in the protocol. So basically every different, depending on what visit the patient's on, it'll require different assessments to be done that day. So I'll start off by pulling all the assessments and everything that needs to be done. Usually get there around 8:30. The patients don't start coming in until 9 or later. And, then when the patient gets there, I ask them how their day's been and sort of see if anything's changed since the last time we saw them. And then I just get rolling with the visit. So we do blood pressure, heart rate, respiratory rate at every visit. And this trial we're currently doing has been all about weight gain.
Okay.
So then I usually weigh the patients and take their waist circumference. And then depending on what visit, some visits require a blood draw. So that's one of the cool things about this job. I've actually learned how to draw blood.
Wow.
So I think not many pharmacists can do that.
Awesome.
Which I thought is a cool skill to have in your back pocket. Other visits will require an EKG. So I've learned how to do set up an EKG and put the stickers on the patient and, run the report. And then, like I mentioned before, I'm sort of learning how to do these rating scales that are required. The CSSRS is one. There's some quality of life metrics we use and just some other rating scales. Sometimes the psychiatrist has to be the one to administer certain rating scales.
Okay. So
then we'll sort of like pass the patient off to the doctor we work with, and they'll spend some time with the patient interviewing them. Okay. And then I'll usually dispense the investigational product to the patient. And there's sort of all these steps involved in, keeping an inventory of investigational product. The patient has to return the investigational product we dispensed last time, even though it's like an empty packet. Okay. We have to keep track of that. Mm-hmm. And so there's all these sort of like pharmacy activities that you do in the background of a clinical trial, which I think is interesting and where my pharmacy background kind of comes in handy. And, once the patient is paid and we give them their meds, we usually either take them home, give them a ride home, or they have like a family member or friend come pick them up. And then that's usually my day. After we collect all the information and make sure everything's, verified we did everything correctly, then I'll usually enter it into the electronic data capture system. And depending on what day it is, I'll have other random tasks that I need to do. So sometimes we get new investigational product in the mail, and I'll have to accept that. It's really highly regulated, so there'll be like a temperature sensor inside the box that I need to like plug into my computer and print a report and, keep all these documents, clinical trials. And if there's one thing I've learned from this, it involves so many regulatory documents and just paperwork. So a lot of my job is dealing with paperwork, but it's worth it because I also get to deal with the patients a lot, which I really like.
So let's talk about the second shift, and I'm using air quotes when I say that. So what does your antidote work look like? Is it part-time during the week, and do you have a regular schedule for that work?
So I don't have a regular schedule for the antidote job.
Yeah.
I actually work 2 different roles at antidote. One of the positions is like quality work, which I can just log on and do whenever I want. So that's really nice because I don't have to schedule it at all. I can literally just do it in my extra time. And I try to do like 2 hours every other day, I'd say, is what I try to get in for that job.
Okay.
But then there's this other job called patient liaison, and that's where I'm actually calling patients that have filled out our questionnaires for interest in clinical research, and then I call them and pre-screen them, and that work I actually have to schedule. So I pretty much schedule that work based on our patient load at the research site, and I schedule like a week in advance.
Okay.
So it's nice that I have like all these different roles because it keeps things interesting. You're not doing the same thing all the time.
Right. Variety is the spice of life.
Yes, it is.
All right. We already talked about apps on your phone. Are there any other gadgets and or platforms, websites that you cannot live without?
I mean, I don't know if I can't live without it, but I know some helpful apps. I use like this one called Momentum on Chrome.
Okay.
It's called Momentum. It gives you like the time of day, all these nice backgrounds on your Chrome page, and it'll say, "Good morning, Geoff." It gives you like an inspirational quote, and then it lets you type in what your main focus is for the day, and then you can also have a to-do list on the side. So since I'm working on my computer all the time, it's helpful to have this stuff like right here on my computer and just sort of keep me focused.
Is that a plugin for Chrome?
Yes, it is.
Okay.
And then I had this other one called Stay Focused, and it like locks me out of social media after 20 minutes a day. But I don't really have that problem anymore. That was more when I was in college on Facebook during class and stuff.
Gotcha. Oh, we never did that. Never. All right. So what's your best life or work shortcut or hack if you have one?
I don't know. Life hack. Oh, okay. So I think my best life hack is asking people for favors. So a lot of the times I think people are afraid to ask for help or ask for like opportunities with things. A perfect example is, me asking for your help in pharmacy school.
Yep.
I ended up getting connected with this like amazing job. So I think just asking people or having like the courage to ask people for things. I think that's my greatest life hack.
Okay. Can you take us through an unusual or eccentric work process that you use regularly?
Yeah. So one of the things I do at the research site at GPI is, I'll be interviewing the patients and I'll have to receive their old IP packet that they return. Mm-hmm. And sometimes you can see where they've taken pills and where they haven't. And sometimes things just don't add up. And, it's like either a compliance issue or maybe they got confused and popped IP out of the wrong punch hole or took things out of order. So I think that's sort of an unusual thing to have to do because you got to kind of figure out like what happened here. And then you have to sort of probe and, figure out what happened. Sometimes the patients say that, they popped it out over the sink and it fell down, the drain. We've had one of our patients pop all the pills out and use his empty IP packet as like a pasta strainer.
Oh, interesting.
So like there's a lot of interesting things I deal with when patients are returning their IP packets, whether it's like figuring out, how they took their pills and how I'm supposed to report that. Or if it's just like, what is on this thing? Like there'd be dirty. And I'm like, I don't. So sort of investigating those occurrences.
Yeah, you really have to get into the weeds about adherence and compliance in those settings.
Yeah, absolutely. And yeah, we have to have like 100% accuracy in reporting too. So that's really important.
So you mentioned calendaring a little bit before. What type of calendaring system do you use, and how do you keep track of what you need to get done during the day?
So I use just the calendar app on my phone.
Okay.
I also use Google Calendars. That's how like I schedule my work through my job.
Okay.
How do I schedule, or how do I keep track of my work during my day? I just like make to-do lists and, prioritize on what's like the most urgent thing. I mentioned that Momentum app. So that's kind of where I do it. I just write my to-do, highest priority, goes on the main page, and then everything else I want to get done just goes on the side.
So you have one major goal that you tried to set for yourself every day?
Yeah, and then I try to like just order things by priority, most urgent to least urgent.
Okay. So let's talk about burnout a little bit. Big topic this year at a lot of pharmacy meetings. How do you know when you're burned out, and then how do you recharge?
So how do I know when I'm burned out? I'll just start getting angry about things that shouldn't get me angry. Like I'll be hungry and I'll be angry that I'm hungry, or that I have to like obtain food, or that I have to cook. And I think that's when I like start checking myself and being like, this shouldn't be making you angry. This is a very simple task at hand here. So I think when I start getting frustrated easily, that's when I know like, okay, you're tired, you're overtired, or you overworked or something. And then, recharging, I think everything from like eating healthy, getting like 8 hours of sleep, every day if you can. And then I mentioned like the meditation. So not only does that help, with focus a lot, I think that also helps with like your ability to sort of take the punches that life brings and, not be burned out by them, or not. You don't get burned out as easy. You kind of just roll with the punches a bit easier.
Okay. Do you have any favorite side or passion projects that you're working on right now?
Oh, yeah. So actually, I'll say two. So my cousin got me interested in bonsai trees.
Okay.
And he has like over 40 trees. And I just found out that like Rochester is like a huge hotbed for the art of bonsai, because they have this guy here that is the only living member of the Bonsai Hall of Fame. So I just started getting interested in this, and I just bought, I think I have like 4 or 5 trees, but I'm learning the art, and it is quite cool. And I like plants to begin with, so it's like a cool hobby. And then the other thing that I'm starting to learn about is my girlfriend's dad is a beekeeper.
Okay.
And so I learned how to like go extract honey frames with him this summer, and extract honey and then bottle it. And now like we're selling it to health food stores. So beekeeping is really cool as well. Beekeeping
and bonsais, the two B's.
Yep.
All right. All right. What books and podcasts are you reading or listening to right now? And how do you consume books and new information?
So again, just like my work style, how I said sporadic, it's also sporadic reading. So depending on the book, I might like rifle through a book in like 2 or 3 days, or I might start reading it, put it aside, start reading another book. So I actually am reading 2 books right now. The first book I'm looking for, it's called The Innovator's Prescription, A Disruptive Solution for Healthcare by Clayton M. Christensen. Mm-hmm. And it's pretty good. It's all about just innovation in healthcare, and like what are the disruptive business models going to be in the future. Okay. And I think it's really interesting. I feel like I have sort of an entrepreneurial orientation, so I like reading books like that. I think they're kind of inspiring. And then I'm reading another book called Blitz, and it's about drug use by the Nazis during the World War II. And I think it's sort of interesting that a lot of the German soldiers were taking Pervitin, and it's like methamphetamine. Oh. And that's like what drove Blitzkrieg. Wow. So I thought that was kind of interesting topic. Yeah, it's very interesting.
So are you a big podcast listener at all, or no?
Yes and no. I try to listen to the Daily and This American Life, but sometimes the Daily is just making me depressed with having bad. I feel like they're just criticizing the country constantly. But one of the podcasts I love is Malcolm Gladwell's Revisionist History.
Mm-hmm.
Super cool podcast. I'm a big fan of that one. And other than that, Joe Rogan podcast occasionally.
Okay. And I'm going to throw in another question that we didn't talk about before, but you're a relatively recent graduate of pharmacy school. So what advice do you have for students maybe listening to this podcast who are getting ready to make their transfer back into the real world?
Don't limit yourself. There are more jobs out there than just community pharmacy, hospital pharmacy, and managed care. There's a ton of other things out there. I'm super thankful that I was exposed to startup realm, because health IT and healthcare startups are definitely a real thing. And I think PharmD degree can definitely come in handy there. I've proved myself worthy several times at Antidote. And, I've been working there for I think almost 3 years now. So there's definitely other ways you can contribute to a team. Just keep an open mind and don't limit yourself.
And then last but not least, who else living would you like to hear answer these questions?
Who else living, right? So currently living?
Yeah.
I'd like to hear about Elon Musk. I think he's a pretty cool guy.
Yeah, you guys are giving me, low threshold people like Oprah, Brene Brown, and now Elon Musk. I'm sure I'll have no problem getting them to answer these questions.
Right.
Well, with that...
If you wanted somebody practical, I could think of somebody practical.
No. I don't like limitations.
Okay.
So with that, Dr. Geoff Brown, thank you for being part of the podcast and sharing how you RX roll.
Yeah, thank you so much for having me. It's been a pleasure.
Thanks for listening to another episode of Farming Your Career, How I RX Roll. This mini-series, we'd invite you to go back and listen to episodes 1 and 2 as well as the rest of the series. Episode 1 features Ashley Clevens-Hayes, a pharmacist, and episode 2 looks at Kelly Hartman, who is a healthcare professional, but outside of pharmacy practice. As well, students, if you're listening to this podcast, my day job is with ASCP, and we have open enrollment and applications right now for our 2019-2020 APPE rotation. If you're interested in something out of the box and a little bit different for one of your non-patient care rotations, head on over to ascp.com/APPE to learn more about our rotation and receive the application form. Applications will be taken until 12/31/18, and we will notify all winners of positions with the APPE in January of 2019. Until next time, it's Erin Albert here. I'm over at Twitter at Erin L. Albert, or you can reach out to us at Farming Careers. Take care.
Thank you for listening to another episode of the Farming Your Career podcast, part of the Pharmacy Podcast Network. If you have ideas or comments for Erin, be sure to contact her through Twitter. Follow her at Erin L. Albert. And remember to keep your career growing.